Good morning, everyone, and welcome to today's Alaska Collaborative on Health and the Environment webinar. Today's webinar is entitled Plastics, Endocrine Disrupting Chemicals and Health, Findings of a New Joint Report of the Endocrine Society and International Pollutants Elimination Network. My name is Nick Reardon, and on behalf of Alaska Community Action on Toxics, I'll be hosting today's webinar. I'm calling in today from Anchorage, Alaska, and these are the traditional and unceded lands of the Dena'ina people. So I'd like to acknowledge and thank the stewards of these lands, along with those of the many places all of you, our guests, call home. For those of you new to these gatherings, CHE Alaska is a regional partner of the National Collaborative on Health and the Environment, and together CHE and CHE Alaska work to advance knowledge and action to address growing concerns around links between human health and environmental factors. So you can learn more about these issues and programs on our websites, akaction.org and healthandenvironment.org. This session will last 1 hour and focus on a presentation by our guests, followed by questions from the audience. So you can type those questions into the chat at any time during the meeting, and we'll get to them kind of in the second half of the hour. Now, on to the reason we're all here today. We're so grateful to be joined by Dr. Jodi Flaws and Dr. Laura Vandenberg, both authors of the recent report from the Endocrine Society and IPEN to discuss their findings. Dr. Flaws is the lead author of this report and a professor of comparative biosciences in the College of Veterinary Medicine at the University of Illinois at Urbana Champaign. The Flaws laboratory team researches the genetic and environmental factors that affect the female reproductive system. Dr. Vandenberg is a professor at the University of Massachusetts Amherst School of Public Health and Health Sciences, with research focused on the effects of chemical exposures during early life stages on health later in life. And we're also joined by Pamela Miller, the founder and executive director of Alaska Community Action on Toxics and co-chair of the International Pollutants Elimination Network, IPEN. So welcome to all of you, and thanks so much for joining us here today. We'll start with Pamela Miller to introduce IPEN, followed by Drs. Flaws and Vandenberg's presentation. So yeah, take it away.
Thank you so much, Nick. And I'd just like to give a big, great thanks to Drs. Flaws and Vandenberg and the Endocrine Society for their extraordinary work on the report, Plastics, EDCs, and Health, a guide for public interest organizations and policymakers in endocrine disrupting chemicals and plastics. It really is a significant and authoritative report of the scientific evidence on the hazards to human health of endocrine disrupting chemicals throughout the life cycle of plastics. IPEN, the International Pollutants Elimination Network, has been just greatly honored to work with the Endocrine Society in producing this report. I'll say just a few words about IPEN before I turn it over to our presenters. I do have the privilege of serving as co-chair of IPEN, along with my co-chair, Dr. Tadessa Amara of Pesticide Action Nexus, based in Ethiopia. IPEN is a global network of over 600 public interest, environmental health, justice, and human rights organizations working in more than 124 countries. So if you're not familiar with IPEN, please check out the website. There's really a great body of work and just an incredible number of participating organizations doing important work in countries all over the world. Our participating organizations are working to strengthen global and national chemicals and waste policies, contribute to groundbreaking research, and really building a global network for a toxics-free future. IPEN plays a critical role in global chemicals policy arenas. The network helped shape the first treaty to ban the world's most dangerous chemicals, now known as the Stockholm Convention on Persistent Organic Pollutants, and remains influential really in the implementation of this treaty, as well as other treaties governing chemicals and wastes, including the Rotterdam Convention, the Basel Convention, the Minamata Mercury Convention, and the Strategic Approach to International Chemicals Management. IPEN identifies and advocates for new chemicals for elimination, brings new scientific information about the harmful effects of chemicals to treaty discussions, and to national representatives, and really builds the capacity of non-governmental organizations as well as governments to press for treaty provisions that are protective of health and the environment at the local to international levels. And IPEN has been working to address the serious hazards of plastics and chemical additives to plastics at the local to global levels. And as stated by Franz Perez, the ambassador for the environment for the government of Switzerland, who wrote the foreword to this report, it is our collective responsibility to enact public policies to address this clear scientific evidence that endocrine disrupting chemicals in plastics are hazardous. So I believe that this report is a call to action to enact protective policies at the local to global levels to protect people and the environment from harmful effects of endocrine disrupting chemicals in plastics. So again, just so grateful to you, both Jodi and Laura and the Endocrine Society. Thank you so much.
Thank you, Pamela. I'm going to just get my slides up here to share with you. And thank you to Che and Che Alaska for having us. I'm going to get us started here, and then I'll turn it over to Jodi, who, as you heard, is the lead author of this fantastic report. And then I'll close it up and we'll hopefully leave plenty of time for questions. Although I'm looking at who's here in the room, I'm not sure that this is all news to you. I think a lot of you are going to hear kind of what you already knew, which is that this is a really serious issue, and the report describes this issue and describes the issue of where plastics really overlap with the question of endocrine disrupting chemicals. So just to get us started, we don't have any conflicts of interest to disclose today. The Endocrine Society is an international organization of over 18,000 clinicians and basic scientists who focus on understanding hormone health. And part of that understanding of hormone health is understanding how environmental pollutants can interfere with the actions of hormones in the body. It's really the endocrine disrupting chemicals, the EDC definition that has been put forth by the Endocrine Society is one of the simplest and easiest to understand, which is that we're interested in evaluating chemicals that interfere with any of the actions of hormones. The report that's shown here on the right-hand side is a really beautiful compilation, in addition to being a really comprehensive guide that sums up the state of our knowledge, specifically, again, where these two areas overlap, endocrine disrupting chemicals and plastics. And it is really meant to be an overview of research that's gone on for several decades and hundreds of peer-reviewed studies. The question of plastics is an important one that is influencing how we're seeing the world around us. There's new data that suggests that the total mass of plastics on the planet is greater than the mass of all living creatures on the planet. And that's a very serious concern. The plastic pipeline is that we continue to make more than 270 million metric tons every year of plastic. And some of that plastic, what we see disappears because it's actually entering into the ecosystem. So we're not seeing it, but it hasn't gone away. Some of it is re-entering the environment in other ways because, as an example, we're incinerating it. And a very, very, very small amount, as illustrated by this little arrow down here, is actually recycled. This is one of the most frustrating parts of addressing the plastic pollution problem, is that the manufacturers of plastics really like to bang the drum of plastic recycling, when in fact, it's really addressing a very, very small part of this overall plastic pipeline. Plastic doesn't just end at the product, but plastic waste is known to contaminate soil, water, air, and the food chain, partly because of the plastics that are sort of distributed out into the environment as waste, but also because a lot of plastics are incinerated. And so we're adding the waste to the overall burden of pollution that affects our air quality. And these are data that come from the WHO and the UN Environment Program that suggests that predictions of not just global chemical sales, but also global plastics production, we have not even remotely hit the peak of what's expected to come over the next several decades. And this figure, I think, is perhaps one of the most shocking that we'll show you here today. We know that our reliance on plastics is something that people depend on for convenience. We know that plastics are widely used as ways to, what we think about as ways to secure the food system, to secure consumer products, but that reliance is also harming our health. From the perspective of the Endocrine Society, much of what we have focused on is the release of endocrine disrupting chemicals from plastics. And as I alluded to a few slides earlier, there's very well documented evidence that the chemicals that are released from plastics as they're being used, chemicals that are released from plastics as they're disposed of, as well as the production of the plastics themselves and the chemicals involved in that production process, that many of them are endocrine disrupting chemicals. We know that at some periods of life, we are more vulnerable than at other periods of life, but even endocrine dogma is changing and recognizing that just because you're past the very earliest stages of development does not mean that you won't be affected by endocrine disrupting chemicals. Again, the most vulnerable periods appear to be periods in our life where our organs are undergoing reorganization, development, the creation of those organs, which is why a lot of research has focused on studying and also the protection of fetuses, infants, babies, and young children. But our understanding of the role of how EDCs can have effects is extending to puberty. It's extending to pregnancy, not just for the baby, but also for mom. It's extending into adult life, and it's also extending into our elderly years. So there does not appear to be a time in our life where we should be blasé about the effects of endocrine disrupting chemicals. And there's also evidence that these effects can impact across generations and even have transgenerational effects on generations that were never directly exposed to chemicals of concern. The evidence continues to mount that endocrine disrupting chemicals in human populations are associated with some of the diseases and conditions that are shown on this slide. Easier to study that in laboratory animals where we can control exposures and where we can understand the mechanism by which these chemicals are having their effects. But this sort of difference between what we can do in a lab and what we can see in human populations is often set up as a false dichotomy. One is actually meant to inform the other. We study chemicals in the lab because we've seen signals from human or wildlife populations about some reason to be concerned, and vice versa. And the first chemicals that I really want to talk about are a group of chemicals that are added to products as a way to provide them with UV stabilization. And I just want to recognize my PhD student who made this figure here in thinking about the fact that UV stabilizers are affecting our environment, both as those chemicals are produced and also as the products in which those UV stabilizers are used are used for their purposes and also disposed of. UV stabilizers are added to prevent products from fading, so to allow them to remain bright in their color, to prevent corrosion or minimize fog in the product, and also to help protect the product that's stored in the container from UV degradation. So they're widely used in plastics and also in epoxies that are used for paint, in building material, and in other consumer goods. The chemical that's gotten actually a lot of attention in this class of UV stabilizers is UV 328. And the reason why it's recently gotten a lot of attention is that it was proposed to be added to the Stockholm Convention by Switzerland. And the reason why is that it is very widely measured in the environment. It's measured, like I said, throughout dust, water, coastal water, excuse me, sewage sludge, but it's also measured in the bodies of wildlife, including fish from around the world, and also in human bodies in breast milk. And for some of the other chemicals that have been detected in breast milk, that does not usually bode well. That's really a sign of a chemical that is persistent in the environment. And also chemicals that are found in breast milk will be delivered to the nursing infant, which raises concern. So this is one of the newest chemicals that's gotten attention from the perspective of the Endocrine Society, because these UV stabilizers are only recently been identified as endocrine disrupting chemicals. This one, UV 328, appears to have anti-androgenic behavior, but a lot of the other UV filters, UV screening chemicals, UV absorbing chemicals have broader endocrine disrupting properties. Okay, I'm going to turn this over to Jodi.
Thank you. So first, I'd like to thank the organizers of CHE Alaska for inviting us and giving us this opportunity to talk about our work. I'm going to talk about a few more chemicals that we know are endocrine disrupting chemicals that are found in plastics. And the first that I want to talk about is bisphenol A, or BPA. This particular chemical is found in reusable food and beverage containers, food can linings, medical and sports equipment, eyeglass lenses, thermal paper receipts, and plastic water pipes. The problem with BPA is that it doesn't stay in these products, and it actually leaches from them, getting into landfills to contaminate wastewater, groundwater, and fresh water. And this particular substance has been listed as a substance of very high concern by the European Union, and it's been demonstrated to be toxic by hundreds of studies done across the world. Now, in addition to bisphenol A, there are BPA substitutes, and there's now becoming strong evidence that these substitutes, which include things like BPA'S and BPF, and some of the structures I've shown here, some of these may be as toxic and sometimes more toxic than BPA. Now, BPA has been shown in many chemicals to impact brain development and behavior. It's been linked with anxiety, depression, hyperactivity, inattention, and behavioral problems. It's also been shown to affect reproductive health. In animal and human studies, it's linked to reduced fertility. It's also been linked with polycystic ovarian syndrome, or PCOS, and sexual dysfunction in men. And it's been linked with breast, prostate, ovarian, and endometrial cancers. Now, another group of chemicals that leaches out of plastics and has endocrine disrupting capability are chemicals called phthalates. Now, these chemicals are used in PVC products, personal care products. They're also used as fillers and medication and dietary supplements, food and beverage packaging, children's toys, and medical tubing. Now, we know that these phthalates leaching out of plastics can reduce testosterone and estrogen levels in animals and in people. And these are two very important hormones for controlling reproduction. Thus, phthalates have been identified as reproductive toxicants. We also know that they can block thyroid hormone action and that they've been linked to diabetes and obesity. Now, another group of chemicals are alkylphenols. Now, these are used in latex paints, pesticides, industrial cleaners, detergents, personal care products, and plastics. Now, these are a family of high production volume chemicals that are surface active, and they're known as surfactants. And because of this property, this is why they're also used as detergents, emulsifiers, solubilizers, and dispersing agents. Now, these alkylphenols end up in waterways and are common contaminants in the environment where they break down to degradation products such as nonylphenol. And we know that nonylphenol, as well as the other degradation products, are toxic, and they have persistent and accumulative properties. And interestingly, these alkylphenols were among the first EDCs discovered due to their estrogenic properties in plastics. And they're commonly being used today as plastics, and particularly in plastics that come into contact with liquids. And this is just to show that alkylphenols have a lot of health effects. They've been linked to male infertility, low sperm count. They can disrupt prostate development. They've been linked with cancers in men, as well as female and male breast cancers in people that have occupational exposures. So perfluorinated chemicals are often referred to as forever chemicals because they really do not biodegrade in the environment. These chemicals are used in water and stain-resistant clothing, contact food wrappers, lubricants, carpet treatments, paints, and cookware, and they're heavily used as a dispersant in firefighting foams. And they're really used to improve stain and water resistance in these products, and they're also in some cases known as Teflon. And we know that these chemicals are also endocrine disrupting chemicals with a lot of different health effects. So two of the most studied perfluorinated compounds are PFAS and PFOA'S, or PFOS and PFOA. These have been used since 1940, and exposure to these chemicals has been shown to disrupt the immune system, the liver, blood lipids, and thyroid function. It's also been linked with lower birth weight, altered puberty, increased breast cancer risk, and associated with kidney, testicular, prostate, and ovarian cancer, as well as non-Hodgkin's lymphoma. Now, another group of chemicals are the brominated flame retardants. Now, these chemicals are put into products to reduce the flammability of products. And because of this, they're heavily found in electronic casing, textiles, furniture foams, carpets, building materials, plastic toys, and recycled plastics. Now, they're in a lot of products, but they've also been shown to have a lot of health effects. And we know from many studies that they can disrupt male and female reproductive development, they can alter thyroid development, and they can affect neurodevelopment. And a lot of times these compounds are doing this by interfering with the sex steroid hormones, as well as developmental processes. And finally, I just want to make a comment that there are many other endocrine disrupting chemicals and plastics. And I want to highlight one of these that are heavy metals. And the reason I wanted to highlight these, because people often don't think about heavy metals as being endocrine disrupting chemicals. But we know heavy metals such as lead and cadmium are used in plastics as pigments, stabilizers, and catalyzers, and they're found in various consumer products ranging from electronics to children's toys, carpeting, and soft packaging plastics. We know from many studies that lead is a developmental neurotoxicant, and there's literally no safe level of exposure in children. We also know that cadmium is a kidney toxicant and causes bone demineralization. And finally, we know that in addition to this toxicity, low dose exposure of humans to these metals is associated with endocrine disruption, infertility, and hormone-dependent cancer. So with that, I'm going to turn back over to Laura.
Thanks, Jodi. So we just want to wrap up with what this report is telling us and why what we've told you is important. So number one, with the increased production of plastics, what we expect will happen is that there'll be an increased exposure of human populations as well as wildlife populations to endocrine disrupting chemicals, which means that we can anticipate that problems associated with endocrine diseases could potentially become much worse. Plastics is really not a sustainable way of addressing environmental issues. They're really, the bioplastics is a very minor contributor to plastics, and they themselves also have chemicals that are involved in their production and chemicals that are involved in their use and manufacture, so that they have the properties that are needed. So bioplastics are not the solution to the EDC problem. We also want to note that with this increased production and increased, not just of plastics, but also the sort of general chemical enterprise, we're really at a place where we need to have an intervention, and it needs to happen soon. And every year that passes where we decide that we still need plastics, we're just delaying a really bad situation. And we also want to point out that this problem is wrapped up in the fossil fuel and climate change issue, that as fossil fuels become less desirable for use in other ways, they're instead being redistributed towards the production of plastics. So the pipeline for using fossil fuels absolutely involves plastics. So plastics is absolutely wrapped up in the issue of climate change. So what can be done? In the United States, we think that there are already policies that exist that should be used in better ways, but also the need for additional policies that can address the question of endocrine disrupting chemicals to protect public health and the environment. We'd like to see stronger bans on endocrine disrupting chemicals in plastics. We think that people have the right to know what they're buying, not just what's in the product, what's in the container, the ingredients, but also what's in the plastic that houses food, for example, beverages, as well as personal care products. And we'd like to put more of this responsibility on the producers to be able to address issues, because right now producers are throwing their hands in the air and saying that if people just recycled, that this really wouldn't be a problem. I think my colleague Fred Vom Saal at least was the first to say it to me, that recycling is the fig leaf of plastic production, right? It's barely covering the most unmentionable parts of the bigger problem here. And right now, the cost of plastic use and the harmful effects of EDCs are really felt by the individual users, who often have the least power in that relationship. And we would like to think about how to externalize those the costs, so that manufacturers have to account for the cost. And our colleague Leo Tresande pulled together a group of people that did a great job evaluating the costs of endocrine disrupting chemicals. And in the United States, we're talking about hundreds of billions of dollars a year. In the EU, hundreds of billions of dollars a year of health damage associated with EDC exposures. What can you do as an individual? First and foremost, we want to point out that this is a big problem that it's just like that plastic recycling thing. We can't put this on individuals and say that the solution is that you can just buy better products. This isn't a problem that you can shop your way out of. That doesn't mean that there's nothing that you can do. It means that you as an individual, you as the organization that you represent, should engage with decision makers at both your local level and on upward as a way to advocate for change, and change specifically in this avenue of plastics and EDCs. In the meantime, what we buy does affect the pocketbook of manufacturers, and refusing to buy products once we know that they contain harmful EDCs is a pressure point that we can create. On an individual level, bringing your own water bottle and taking your own takeout container and bringing your own coffee cup and not using throwaways, and instead, and refusing it when you can, right? Order your takeout Chinese, but you don't need the 800 packets of single-use soy sauce that you'll probably throw in the garbage can. That's all plastic that's being given to you. So as much as possible, when we can say no to those things, we should. And then a little bit of just sort of plastic hygiene in the house. So try not to put plastics in the microwave. Don't put them in the freezer either. Try to use reusable glass or ceramic-based storage materials for yourself and your own family as much as possible. And we do want to acknowledge that this big report that took, I think, us more than a year to put together is the work of a large group of people, including the individuals who are noted here, who were really instrumental in being able to complete it. So I'm going to stop there, and we're happy to entertain your questions, but also any comments that you might have, because again, I'm pretty sure none of this is really new news to you, but I think that that your perspective on this topic will be very welcome.
Thanks so much, Pam, Jodi, and Laura. Yeah, we've definitely got some questions coming in. Let's take a look here. One of them early on here is asking, how do EDCs still affect elders?
Right. This is a great question. There's not nearly enough evidence on this topic. For a long time, endocrinologists really split up the effects of hormones on what happened during development and then what happened during the rest of life. And what really became apparent, even from pharmaceutical testing or large cohorts, is that exposure to hormones and hormone replacement therapy put women at increased risk for certain diseases while protecting them from other diseases. That was a real turning point in an appreciation for the fact that the menopausal transition period is still a period where women could be affected by hormones in negative ways. So there haven't been, in my view, nearly enough studies of endocrine disrupting chemicals. Hormone replacement therapy is an endocrine disruptor. It's just one that you're choosing to take. There hasn't been nearly enough work that's been done on human cohorts and looking at endocrine disrupting chemicals. There are certainly studies that are suggesting that earlier adult life exposure might be increasing your risk to conditions that start to manifest in elderly life, like Parkinson's disease and Alzheimer's, some associations with endocrine disrupting chemicals that are pesticides. But there's starting to be more of an attention in the laboratory animal world looking at older animals. And our colleague Andrea Gore, who's also a co-author on this report, I think is really a leader in looking at rodents don't really have menopause. I like to joke it's mousepause, but that's not really a thing. Looking at that transitional period as females lose their reproductive capacity, that endocrine disrupting chemicals still do have effects on them, like PCBs as an example.
Thanks. Another question here is, if we want to evaluate EDC's effects in a study population, are there particular biomarkers or hormones that are the best choice to measure?
Ooh, great question. So I think part of it has to do with the mechanism of action of the EDC in particular that's being examined. You know, if you're interested in EDCs like the brominated flame retardants, then you would want to account for changes in thyroid hormone. But thyroid hormone or thyroid hormones are complicated because you may be in what is considered the normal range for the population, but it might be an abnormal range for you as an individual, right? You might have been shifted out of your sort of the normal range of how your body likes to function. So having some knowledge of your own body and your own hormone biomarkers is important as an individual patient. Much more complicated when you're talking about designing a cohort study and evaluating those across populations where you don't really have that same sense. I do think that there's been a lot of attention that's been given for cohorts that are looking at couples that are having infertility problems and looking at both hormones that have classically been thought of as male or female hormones, but also hormones that are related to ovulation or to the production of healthy sperm. In terms of, so I don't know if the comment that just popped up in the chat was relevant, but biomarkers, right? The biomarkers of exposure are going to be biomarkers that are more related to how much BPA or phthalates or PCBs or PFAS are in your body. And associating those with hormones, you would have to look for different biomarkers, different measurements in order to know that an effect has happened on the hormone level. So the hormone stuff is actually the easy stuff because that's where, you know, the clinical world has done all the work for us that we already know to collect those kinds of data from couples who are having infertility problems or for people who are having trouble with issues related to controlling body temperature or body weight in order to evaluate thyroid hormone. There's really, really good methods that are just standardly used in the clinical world to evaluate hormone biomarkers. the endocrine, the EDC biomarkers, right? There's a couple of labs, more academic labs, but only a couple of labs where you would potentially, as a clinician, send samples to evaluate a patient.
Thanks, Laura. Another question that's popped up a couple times here is do the EDCs have a dose-response relationship?
This is my favorite question. It's like you're throwing me little softballs here, right? So when we think of toxicants, when we think about toxic chemicals, we often, the saying is the dose makes the poison. So if you fall into a vat of formaldehyde, you would expect the effect to be worse than being exposed to small amounts of formaldehyde that are used as are residues in baby shampoo. Endocrine disrupting chemicals, of course, are toxic at those high doses. If you fall into a vat of DDT and you drink your body weight in DDT, you're going to die. What most of us are exposed to is not those dose levels. That's not what we're worried about. Instead, what we're worried about is that our exposures are not in that toxic range. They're exactly in the endocrine active range. And so for endocrine disrupting chemicals, just like for hormones, there's a lot of evidence that they have non-monotonic curves. So now if you're watching me on your screen, I'm going to just show you, like, if this is what your axis is, a monotonic curve would look like this, a greater effect with greater exposure, right? What we're talking about are non-monotonic curves. They look like this, an upside down U or a U shape, where actually moderate levels of exposure can have some of the worst effects. This is absolutely true for hormones too. So, if you have both too high or too low testosterone levels, you're at increased risk for some pretty nasty forms of prostate cancer. So, in the middle is where we want people to be for prostate health. And that's a natural hormone. Endocrine disrupting chemicals are kind of the same way. So now you're saying, wait, so why don't we just make sure everybody has like a whopping amount of EDC in their body, like, to get out of that mid-dose range? My PhD advisor would say, because you're not a walking prostate. Right? The dose response curve for where you're going to have the worst effect on your prostate is not going to be the same dose response curve for where you'll have the worst effect on your brain or where you'll have the worst effect on your bone. And so we can't play this dodge the dose response curve game of, I'll just make sure that I'm exposed to the amount that's not harmful, because that amount will change throughout development, and that amount will change depending on what health outcome you're worried about. So unfortunately, I think endocrine disrupting chemicals go into that same bucket as lead, where we really need to stop thinking about them as what's the dose that's safe, and instead recognizing, because we're not all at the same stage of development, because we have a range of different body parts that act and require hormones in different ways, there is no safe amount of exposure to endocrine disrupting chemicals.
How about, there's a question here from Heidi Hansen asking, is there any evidence that these effects on human and animal health are reversed if exposure is ceased?
Right. So, so that gets again back to this endocrinology dogma. If you think about birth control, right? A woman takes birth control. Birth control is an endocrine disrupting chemical. It's a chemical that structurally looks very similar to the estrogen in your body, but it's a synthetic chemical and it modifies the endocrine system. You take birth control, you will lose your fertility. You stop taking it, your fertility comes back. Right? So it has a transient effect. Endocrinologists will refer to this as an activational effect. Your body is activated to respond when the hormone, in this case, the EDC, is there, and it does not, it's no longer activated when the hormone goes away. And thank goodness, because otherwise we as young women would not be able to take birth control if we were making a decision to permanently sterilize ourselves by taking that. That's very different than what happens if you're exposed during a sensitive window of development. So if you're exposed, and the classic story of diethylstilbestrol, or DES, illustrates this very well. For girls who were exposed to DES, which is a synthetic estrogen, much like birth control. In fact, it was used as birth control, but it was also used to help with the mistaken idea that it would help maintain pregnancy. Doesn't make any sense in hindsight. Girls who were exposed to DES in the womb were permanently altered by that exposure. There were permanent changes in the development, in the literal structure of their reproductive tract, in the development of their reproductive tract. It made it so that they would be at increased risk for having malformations of the female reproductive tract, but also increased risk for infertility, increased risk for breast cancer, increased risk for altered timing of menopause. So there's no fixing that as it's happened to the DES daughters. And there appear to be, at least for some of those outcomes, similar effects on the DES granddaughters. And we don't know how many generations down the line we're going to continue to see those kinds of adverse effects, but there's no reversing those. And that also gets to the point that I made about how we need to stop sort of seeing development as only what happens prenatally. The women who took DES during pregnancy, they also had an increased breast cancer risk. It wasn't as severe as what their daughters experienced as increased risk, but being exposed to DES during pregnancy did also affect those women. And yes, I just saw Lisette's question. Also DES sons, increased risk for male infertility, increased risk for cryptorchidism and hypospadia, increased risk for other like testicular cysts and other problems. So no one gets off scot-free in the DES story.
There's a few questions that have popped up here asking a bit about regulation and kind of assessment of the risk. So that they're asking, do you know of any efforts to increase the requirements for identifying EDCs in products? For example, material safety data sheets. And is there, what is the regulating body in charge of that?
So in the US, chemicals are regulated, but most of the chemicals that are sort of out in the world are regulated by EPA. Most of those chemicals are regulated based on TSCA, which was reformed in 2016. But some are also regulated as pesticides under FIFRA regulation. Chemicals that are used in food contact materials are regulated by the FDA, in medical devices, FDA, and then also some of these are actual pharmaceuticals where we don't think of them as endocrine disruptors, but they're released into the environment in urine. And so we're still releasing an endocrine disrupting chemical. So the regulation framework it depends on what the chemical is being used in, who's responsible for overseeing the regulation in the US. The same is true, but a different story in the European Union. I would say that the European Union has much better efforts underway to be able to identify what is a known EDC versus what is a plausible or possible EDC. And they have created a stronger regulatory framework around once something is identified as an EDC, what will they do about it? It will go on certain lists. You will have to reduce its use. You'll have to identify safer alternatives. In the United States, I think most of us who have watched the regulatory system not address EDCs have been disappointed in what's been done. So the release of EDCs into water is regulated by EPA under the Clean Water Act. And it requires that chemicals be tested with methods that most of us would consider to be insufficient and poorly predictive of what we actually would see as effects in people. And the total number of chemicals that have been tested through the EPA's screening program, the endocrine disruptor screening program, the EDSP, they can't be counted on my hand, but they could be, it wouldn't take a lot of hands to be able to count the total number of chemicals. So where the FDA alone has this endocrine disruptor knowledge base, which has about 1,200 chemicals in it that are suspected EDCs, the actual amount of studies that have been done in some way to regulate those chemicals is a very, very tiny slice of that overall pie. The other challenging issue is that I say this with all respect as a person who uses animal models in my research. The EPA administrator 2 or 3, I think 2 years ago, so it was under a different administration, the EPA administrator said that their goal was to move away from all animal testing, to not require industry to do animal testing, which as a person who uses animals, I can tell you that I actually support using fewer animals in testing, but then we have to decide what counts as enough evidence. If we're not going to allow people to do tests on mice and rats, is a cell-based assay sufficient? How many cell-based assays? What kind of cell-based assays? And that answer has not been provided by EPA. So until they decide what evidence is enough, the system is sort of set up to say, we'll no longer accept animal data, but cell data is not acceptable. So I guess it's a free-for-all, and humans will continue to be the guinea pigs that we use until we discover something really terrible has happened. And even there, when we talk about chemicals like BPA and phthalates and PFAS, we've got plenty of human evidence, and we're seeing the regulatory needle move very, very little. It's frustrating, I'm sorry. I need like the womp womp horn. Womp womp.
Zoom will be coming out with that feature. You mentioned so this research is, the use of animals to try to assess these risks and these biological processes to better understanding they might affect humans. There are a few questions that have come in asking about, so do we understand or do we see the results of endocrine disruption in companion animals like cats and dogs and birds, or is this studied in any veterinary science?
I love that question. Yes, is the answer. Cats are actually really good sentinel species because they eat a tremendous amount of dust. So chemicals that end up in house dust, because they clean their bodies with their mouths, they eat a tremendous amount of dust. And there's been some great work from colleagues in Scandinavian countries, including, I think it was Oka Bergman, but don't quote me on that, whose lab was showing that PCBs and other brominated flame retardants found in dust could be measured in the bodies of cats and were actually associated with thyroid hormone disruption in cats, wasting diseases in some cases in cats, as well as, so it goes in both directions, right? The hyper and the hypothyroidism, depending on what the chemical exposure is. There's also a fascinating literature that is evaluating obesity in companion animals. And that literature is hard to disentangle, just like the human obesity literature is hard to disentangle. How much of this is lifestyle driven? How much of this is based on exercise imbalance and changes in jobs, right? We have more inactive jobs compared to just a generation or 2 generations ago. But there's some fascinating research that looks at feral animals that live around people. So like feral rodents, they're also becoming more obese. So you can't really say that a feral rat isn't getting enough exercise. That's not a thing, right? No one exercises a wild animal. And yet feral animals are also becoming more obese. So yes, great question about companion animals and also animals living sort of at the periphery of human life.
Sticking to the animal topic, there was another question about, are there non-animal strategies for studying these endocrine disrupting chemicals?
Yeah. Absolutely. So in fact, the EPA and the National Toxicology Program have each developed non-animal strategies. So the EPA's is called ToxCast. The National Toxicology Programs is the Tox 21. Collectively, these are dozens, hundreds, or even a couple thousand screening tests that can be done to evaluate whether something is an estrogen receptor agonist or antagonist, an androgen receptor agonist or antagonist, and on and on and on through the different sort of receptor and biological systems that can be probed. So I don't want to diminish that as an important scientific contribution. What needs to be done is to figure out how do we use the data from Tox 21 and ToxCast in regulatory decision making. And I think I said that when I was still a PhD student. I was like, this is great. How are we going to use the data in order to improve public health decision making? And I was told, it's fine, it'll get figured out. And now here we are, how many years later, and I'm still saying the same thing. So I think that there's the gaps in our knowledge are actually getting smaller. We're getting better at being able to test things in vitro, but we haven't yet figured out how to use those data. Now, I also just want to say, because I know some of my colleagues would be very upset if I didn't say it, cells can't replace all of the things that we know in our body, right? There is no cell culture model for IQ or memory or autism spectrum disorder. And cells in dishes, I'm still not convinced can help us to understand the whole developing organism. But I do think that they can be used to screen chemicals out so that if you see something of concern, you don't ever need to even get to the animal. We could save how many animal lives? And this is the TIPED approach that now also is 8 years old, almost 10 years old. If you start and you find a red flag in a cell-based system, don't ever go and expose an animal to that, because it's not likely that you're going to say, oh no, we were wrong in the data from the cell-based system. You're only going to be confirming, and you've spent a whole bunch of money doing it when you could have instead been looking for a safer alternative.
Shifting gears here to focus in more on the plastics themselves, there's a few questions. One is asking if you think it's actually possible or feasible to recycle more than 10% of plastics. And there's another question kind of highlighting that we use plastic tubing and medical equipment in lots of daily procedures, inhalers for asthma, and they're wondering what can be done to replace EDCs in these, and will it have effects on the health problems those products are trying to address?
Yeah, great question. So first, let's start with, could we recycle more? I think one of the problems is that what we see as plastic is actually a huge mixture of other chemicals. So it's labeled polypropylene or polyethylene, but it's got all these other chemicals that have been added to it as dyes, as UV stabilizers. And so even if you put together all the things that were labeled polypropylene, you still have all of these other chemicals that are mixed in with it. And that makes it very difficult to recycle those plastics together. It's become a very big, expensive problem. There's also the issue that when you do recycle plastics, you're always downcycling. So whatever it becomes next is a lower quality plastic, as opposed to something like glass or metal that can be sort of same cycled. I don't know what the word is for that. So I do think we could do better with plastic recycling, but I also think part of the problem is it still puts the problem on the individual. And I don't know what to do with something like, it's easy if it's, a can, a bottle, I know what to do with that. But a lot of our plastics, they're things that we're not even really thinking of as plastics. Your clothing is full of plastics. So what do you do with that? Can we recapture that plastic that's been produced? Because when you throw your clothing out, those fibers are released into the environment, right? You're releasing plastics, even though you didn't think of it as plastics. So I think that's the first problem. The second part of the problem, you asked me about, medical equipment. Right. So, I think I don't think this is what the question asker was saying. Like, you're trying to send us into the dark ages and you want, babies to die. But often that's what industry will say is, you're saying we should ban plastics and therefore babies will die in the NICU without proper treatment. People won't have their asthma medication. So I have two answers to that. One is, there was a great study that was done by researchers at Harvard School of Public Health and the CDC, where they were looking at babies in the NICU of two hospitals, Hospital A and Hospital B. Hospital A had taken no efforts to alternatively purchase their products that were used in the NICU, but Hospital B had purposefully tried to find products that did not have phthalates and did not have BPA and did not have other known endocrine disruptors. The health outcomes for the babies, so it's NICU, so we're not looking over 50 years. We're like, do they get discharged at the same rate? Do they leave the hospital in a healthy state? Hospital A, Hospital B, the same. Endocrine disrupting exposures, whoppingly different, hugely different. So the body burden, different, the health outcome, not different. So we need to shop better when we have the power to make those sorts of decisions. When we're thinking about things that are more like asthma inhalers, like the plastics that we interact with, I think part of the problem is that we have just accepted that in order to have plastics, we have to have endocrine disruptors. And I think we need to push back on that. And I would like to believe that humans are smart enough and innovative enough to say, I still need this use, but I don't want all of these negative side effects. Because again, what industry is asking us to think is that the choice is between asthma inhaler or death. And I think the choice is between toxic asthma inhaler and non-toxic asthma inhaler. Now, does it exist right now? Probably doesn't. I don't know. But we need to push back on that dichotomy and say, no, we're like, I would like to reduce plastics. I would like to reduce plastics as much as possible. But for something like an asthma inhaler, we might not ever be able to get away from plastic entirely. So let's go for the safest plastic we could possibly make.
There were several people asking what the title of that study is you're referencing.
Russ Hauser is, I think Califat is the first author. I don't have my EndNote open. It'll take me a second. I'll put it in the chat before we leave.
Thanks. There's another question here, and it might probably be our last one, that's asking, so you're talking about these plastics and their degradation, but how have these chemicals been studied in terms of them getting into foods? In particular in Alaska here, there's concern about traditional foods and subsistence foods for the first people of Alaska.
Right. I think we're talking, there's two issues here. One is the chemicals in plastics are absolutely measured in fish, including fish that tribal populations depend on. They also move up and down the food chain, some of them. So I know tribal populations often depend on other sea mammals that have layers of fat in their bodies. And these are chemicals that are some of them are chemicals that persist and store in fat. Those UV stabilizing chemicals, this is what our worry is about them, is that they're being released into the environment and stored in fat. The question of plastics themselves, so I'm not an expert in microplastics, but there continues to be evidence that mounts that micro and nanoplastics are also entering the food chain and are entering our bodies. And so we are potentially being exposed with health outcomes that we don't even realize of consuming little bits of plastic, and how are they breaking down? Are they breaking down in our digestive tracts? So yes, there's I think that folks who are who self-garden, who hunt, who do subsistence fishing, that often make those choices because it allows them to be in touch with the environment. There's parts of our environment we just aren't in control of anymore. And these chemicals entering our air and our water and our soil means that they're contaminating the bodies of wildlife also.
Yeah, thank you for answering that question and all the preceding ones, Dr. Vandenberg. I think I speak for everyone listening, express our gratitude for following along on all those different topics.
I was really worried that I wouldn't be able to tell you anything you didn't already know. So thank you so much for all of those great questions. I did put my Twitter handle in the chat. And then I also put the reference to the Neonatal Infant Care Unit study, which is now more than 10 years old, but it's in Environmental Health Perspectives, which means everyone will have free access to it.
Wonderful. I will send out an email within the next day or two with a link to a recording of this conversation and an updated list of related resources that helps folks. And yeah, thanks so much to all of our speakers. Thanks, Dr. Vandenberg. And I'll say before we bid farewell that our next CHE Alaska call will be on Wednesday, April 28th. And we'll be joined by Dr. Ruth Etzel, the former director of the Office of Children's Health Protection at the EPA. And she'll be presenting on a recently published book, Protecting Your Child's Health, Expert Answers to Urgent Environmental Questions. If you can, please donate to support these monthly CHE calls and ACAT's other efforts. And any additional questions or comments, feel free to email me, and you can call our office at 907-222-7714. Yeah, thanks again to everyone, and yeah, wishing you a wonderful rest of the day.